Good evening once again, everyone. I'd like you to confirm in the chat that you can hear me. Just kindly say yes, we can hear you, or I can hear you in the chat. All right. Thank you, Blessing. Um, so I like to believe that every other person in the meeting right now can hear me as well. So my name is Oluwapolimi Ala. I'll be your host for this evening, and I'm happy to welcome you all to another edition of Health Facts Live. We held a similar one last 2 months, yes, 2 months ago, where we had a human nutritionist talk to us about consuming a colorful plate. So this time around, we have a physiotherapist talk to us, and this evening's topic is managing chronic low back pain strategies for relief. And I'm very excited to listen to what our expert has to tell us this evening because I'm sure it will be beneficial to me as it will be to everyone that would get to listen as well. So if you have questions, you have the chance to ask at the end of the session, and I expect that everybody will gain maximally from it. So thank you very much for your attention thus far. Before we start the main webinar for this evening, I would like to give us a brief overview or a brief intro about what we do at Health Facts Nigeria, the organization that has put this event together. So I'll be sharing my slide in a minute. So once again, my name is Dr. Ola Polimi Ala. I'm your host for this evening, and I'm the operations manager at Health Facts Nigeria. So at Health Facts, we are an online media company that provides health and wellness information for Nigerians and Africans. And we do this by covering topics on diseases, lifestyle, nutrition, and research and news on our website. We also create health quizzes, stories, videos, and other engaging content on various health issues. Our aim is to empower people with accurate and relevant health information to make informed decisions about their health and well-being. Our mission is very simple, and it is to address health-related problems by providing accurate health and wellness information in the simplest form possible. And how do you do this? We have blog posts on our website where we share articles, news, updates, and health-related quizzes. We also share infographics and videos on our social media pages and periodic health alerts where subscribers get updates on trending health information and health highlights. Another activity that we engage in is such as we have this evening, where we have a periodic webinar called HF Live that health professionals are invited to speak on health-related topics and participants can ask questions. We also organize medical outreaches to local communities where we provide, where we address community-specific pressing health issues through health talks, free medical consultations, and basic checkups. The last one we held was in Oremeji in Ibadan last month. And if the healthcare HF video service, which I'll be talking about more later in the presentation. So I've talked about the blog posts. They are expert written articles offering in-depth analysis and expert opinions on various health topics. Infographics are available on our social media pages as well as the videos I will create. That they are practical tips and advice on healthy living, wellness, and disease prevention. The health alerts, these are samples and they are shared periodically via email and on our social media pages. They are convenient and accessible to people that view. HF Live is a webinar that we have now, and we've had series in the past. They're available on our YouTube channel, where we've spoken about hepatitis, breast cancer, breastfeeding, colorful health plates, health insurance, and more. You have access to this by visiting our YouTube channel, tagged Health Fact Engine. Then we've organized medical outreaches where local communities have benefited from health talk, free medical consultations, free medications, and basic medical checkups. And lastly, I'll be talking about the Health Facts video service. It's an expertly created evidence-based content series that is focused on 6 essential health categories. Number one is diet and fitness, then diabetes care, hypertension care, skin health, sexual health, and general health tips. This video series is specially contextualized for the Nigerian audience, where we focus and we take into consideration the culture, the Nigerian diet and lifestyle, and they are structured in such a way that the learning experience is sequential, allowing the subscribers to build on foundational knowledge and deepening of understanding in core health areas. So to have access to this service, all you just have to do is to dial star 7728 hash with your Glow SIM, and it is straightforward from there. So here are social media pages. I would like you to engage with us, and I thank you very much for your attention. So thank you once again for your attention thus far. Quickly, we'll be moving on to the presentation proper. Give me a minute to share the slide from our guest speaker. And also I'll be reading his bio. So this evening, as I said earlier, we have with us a physiotherapist in person of physiotherapist Emmanuel Oladejo. He's a dynamic University of Ibadan trained physiotherapist and certified first leader with the Nigerian Red Cross Society. He a privileged recipient of multiple awards, including the College of Medicine, University of Ibadan's Provost Award for Community Impact. He was the best graduating clinical student for his set, and he received multiple certifications from national and international medical rehabilitation professional bodies. Emmanuel is the founder of Physio Talks Africa, where he inspires wellness culture among African youth toward unlocking their physical and mental well-being potential. He's fondly called Global Man and is quite known for championing wellness and health advocacy programs, medical outreaches in slums, underserved communities, and aired as resource speaker on multiple radio stations, including Welsh Radio, UI Radio, Agidigbo, and Niger FM across southwestern Nigeria. He's a serial volunteer with Czech Medical Missions, Sido Foundation, Jerry Health Nigeria, among others, and an evidence-based testament of God's love and care to a decaying world. So I'm very much enthusiastic about what physiotherapist Oladejo asked for us this evening, and I'll be sharing his slide in under minutes. Thank you for your attention thus far. I'd like to confirm if you can see the screen. I mean, the slide I'm trying to share right now. You may just answer in the chat. All right, thank you very much for your response. I'll hand over to our guest speaker to carry on from here. You have the floor, sir. Pleasant evening to everyone. Um, Having issues on muting my video or signaling that I'm audible, also be visible. I'm sorry, I didn't hear you. What did you say, Mr. Oladejo? Okay, so I would like to also be visible so that people can appreciate the speaker. Like Yoruba would say, Ojulorowa. So I would like to, okay, and if we are still having challenge with the video coming up, because I'm not able to start my video here. Anyways, we can always move into. Now. Okay. Okay, great. All right. I want to know that you can all hear me and see me. It's my pleasure to be here this evening. I want to say a very big thank you to our hosts and the team at Health Facts Nigeria. I would say that I'm really delighted because I enjoy getting people get health aware and also inspire people to develop a wellness culture that would enable them to live a pain-free life and also live better, move better, and even if they have health issues, also heal naturally so that they can be able to do what they love to do that they are unable to do. So it's a pleasure to be here to discuss one of the most prevalent health topics and concerns, which has served as one of the top reasons for visits to the hospital. So a number of people with musculoskeletal complaint, they visit the hospital because they have suffered low back pain. And I believe that at the end of this lecture, we'll be enlightened to the strategies, not just to control or find relief, but also to prevent this menace from we being victim of it. So everyone can lead a back pain-free life, even though statistic has it that over 80% of people would, at one point or the other in their lives, come down with low back pain. So you can take yourself as part of the 15% that would not be a patient of low back pain. So let's move on as we dive into the section. I believe that I'm audible. All right. So my outlines are why exactly do we need to talk about chronic back pain? And we need to also understand what does chronic pain means? What does acute back pain means? What are the common causes of chronic back pain, especially in young adults, which I believe that they are the chief audience or participants that this webinar is targeted to. Also, what are the warning signs that you shouldn't ignore when you have this? And what are the strategies for you to have relief, to move from pain to power? And also a wellness toolkit for you to take home with you to keep living a back pain-free life. All right. All right. So talking about chronic back pain is
if I get host to unmute on this call and throw uh, the question that how many of the participants here in the last 3 months or 6 months have experienced back pain, I believe that 80% of persons on this call would, I want us to even drop in the chat box, just put yes, that if in the last 3 to 6 months you've experienced back pain, especially low back pain, I want you to put yes in the comment section. And if you have not experienced back pain in the last 3 to 6 months, I want you to put no. Let's have that. Okay, I can see yes already. So I know people that are actually following us. Okay. Okay. So if you have not had back pain in the last 3 to 6 months, you can put no. Okay. Because even interestingly, the physiotherapists who are the go-to experts when it comes to chronic back pain management, oftentimes when they are not careful, they also suffer back pain. And you see the physiotherapists saying that they also need physiotherapy. So back pain is, as WHO estimate, is a leading cause of disability worldwide. And individuals are often affected because of sedentary living, because of their poor posture, especially, and long hours of work, inadequate physical activity. All this leads to chronic back pain. Let's move. So back pain doesn't have to be a part of your work life experience. If you follow our lecture keenly today, there are several causes of back pain, which we'll get into. But I want us to understand that when we say chronic back pain, it's a pain experience that has outlasted about 12 weeks or more. That's 3 months or more. Why? That feeling of unpleasant experience at the low back region that is between a day, 2 days, and less than 3 months is still termed as an acute pain. So oftentimes it's due to maybe strain, you maybe did an exercise or you made some movement, upward movement, and with rest, you just see that it disappears on its own with not so much. But for chronic pain, it keeps persisting, even when the tissue seems to have recuperated. And oftentimes people think that, oh, when they hear something is chronic, they think it's so life-threatening and it's going to be they get very apprehensive, but that's not exactly what being chronic means. So being chronic, when they say pain is chronic, it just means in term of duration that's outlasted 3 months. And it will require expert management, it will require lifestyle modification as well. Let's move because of our time. Okay, so the common causes of low back pain, they are not just limited to this, but these are some examples of them. Like I mentioned the other time, poor sitting posture. Weak core muscles also contributes to back pain, as well as poor lifting technique, the way people lift in their work. Oh, you see that someone that is not even maybe a laborer in that kind of sense. He doesn't work on the side, he doesn't work in a firm, but even working in the clinic as a nurse or as a physiotherapist, where you have to lift your patients, you have to assist these. So even at home, you may be a carer, you have to lift people. There are techniques to this. And once you lift improperly, the spine is going to react to that. So obesity is also another common example of chronic cause of chronic low back pain, as well as sedentary living. So, and your spine is not designed to actually keep staring at your device using your system with a rounded back. All those lead to back pain at the end of the day on a longer note. So let's move. All right. So before the warning signs, I also want to add that there are other causes of back pain. Trauma can lead to back pain. We can also have systemic um, concerns, systemic issues leading to back pain. For instance, in the clinic, we have patients who walk in and say, oh, they have back pain, and it has been for a long time. They are not getting better. They've tried these drugs, they've tried these other medications, and they've not had relief. On assessing this patient, we get to discover that it is deeper than a mechanical problem. That this is not just an issue with the ligaments at the back, nor is it an issue with the muscles at the back, nor is it an issue with the joints at the back, nor is it an issue with even just the nerves. But there's probably an infection going on. For example, tuberculosis of the spine, an infection that has spread to the spine. Another example is cancer tumor in the spine. All those can also give back pain. There's a particular term that we call a referred pain, where a particular organ is being affected, but the symptoms is being felt in another location of the body. And for example, if there's a kidney problem, the person can have a back pain. So as experts, we get to ask questions that are targeted towards seeing that this is just a non-specific back pain. This is of mechanical origin due to maybe poor lifting, due to aging, or due to poor sleeping posture or sitting, etc., and the likes. But when it gets to those of systemic concerns, the appropriate thing is that referral to be made to see an orthopedic specialist or to see a neurologist as appropriate. So warning signs that you should not ignore when your pain is persistent. Also, when you start feeling the pain running through to your legs, you should not just sit down and use Aboliki, use this rub, use that ointment, and keep it at that. You should walk into the clinic to see a health professional for proper management. Also, when you start experiencing some form of tingling, numbness, maybe at the foot, all those are also signs of could be signs of problems from the spine, from the back. When your back pain worsens with positions, you sit, there's pain, you stand, there's pain, and you have to dose yourself with different pills. Today you're on diclofenac, tomorrow you're on ibuprofen, next tomorrow you're taking pregabalin, and you have to depend on these medications to keep alive and good. So all these things can, this can actually aggravate and become and lead to disability. So it's important that you don't stick to just self-management when you see all these warning signs. Yes, painkillers, they max. So it's important that you walk into a clinic to get properly assessed and properly managed to address your pain. Because let's move on. So address your pain before it aggravates. Yes. So what are the strategies for relief? Like I would like to reiterate that pain is actually a pointer. So when I say I have low back pain, it's actually a pointer to a diagnosis. So low back pain could be many things. Like when you come into the clinic and we carry out our physical examination, after asking you a series of questions to know what exactly is the root source of your back pain. So because the back pain is just a pointer to able to get you help, is a form of alarm system to get you to seek help before things get out of hand. And so we get to come up with a diagnosis based on your physical assessments, based on even radiological findings of what exactly is going on with your back. So some persons would have back pain, but it might be a sacroiliac joint dysfunction. So I don't mean to bore anyone that is not a health professional on this call, because I know that it's public health center and would make it as simplified as possible. But part of back pain is not just back pain. Some, just like I mentioned, that there are some that could be as a result of even presence of tumor, presence of infection. Also, even when it is mechanical, for some persons, when they cough, their pain increases. When they try to sneeze, when they try to use the toilet, so their pain increases. For such people, we are looking at them having something that is pertaining to their disc. Those are the cartilage at the spine that are in between each vertebra in the back. Like you will see an image of the spine here. And the spine is not a straight line, it's not letter one shape, but the spine is a kind of reverse S shape. So for this person is not sitting properly, and that's why there's reduced what we call lumbar lordosis, especially at that low back. So because the person is sitting with a rounded back, and this is how many persons sit from 8, 9 a.m. to 4 p.m., 3 p.m., 5 p.m. of their working hours using the system, especially now that it's a digital world. If you look at the slide by the right side, it shows us how to sit appropriately, which is, firstly, you need to sit into the chair, and then you need to ensure that you chest out and your gaze, your shoulders are relaxed, your chest is out, and your height, just like my device now, my device is almost at the level of my, I don't necessarily have to hack into the phone for me to be able to see it. So I can sit comfortably. My seat is at 90 degrees to the floor. My hip is at 90 degrees to the floor. So that's very important for us to be able to cushion our low back and get us into a pain-free position. And then to also maintain proper alignment of our pelvic, which is where the spine sits into. So chest out, sit on a high platform. Don't use sit that are too low. Sit that your knee and your ankle can be 90 degrees to your hip. So you discover, especially for males here, that when you go to the salon, you feel quite comfortable. One of the advantages or one of the ergonomic compliance that those chairs have is they have heighted, the seats are well heighted, and that will help to give good cushion to the spine. So one of the key strategies for relief and for you to move from pain to power, because pain can be disabling, and if you're in pain, you would hardly be able to think clearly, to be able to make impact, or to be able to work productively, to make a difference in your environment. So one of the recommendations that I have for us is that we should employ the use of ergonomic chairs. ergonomic compliant chairs that would keep your back well supported. And if you don't even have access to one, you can put a throw pillow behind your low back and keep that trunk as erect with your chest out and with your shoulders relaxed. So those are practices that are unharmful to your spine, because many persons have learned practices that are harmful to the spine. It's necessary that through this webinar, you don't just listen or you don't just attend, but you unlearn those habits and learn habits that would help that will save your spine. Good. So I've talked about you're also adjusting your device to your high level. So when you're using a system, the edge of that system, the topmost part should be at almost 90 degrees perpendicular to your high, So you don't necessarily have to hack into it, because by hacking or putting a rounded back or slouching and sitting like a chairman, you will be putting a lot of tension on the ligaments, not just that, also on the disc at your low back. And over time, you may come down with low back pain. Okay, so I want us to move. Footrest is important, and using the 90-90 rule, like I highlighted, is also important. So things that you could even do at home. Of course, when you have the signs and the triggers or signals that I mentioned earlier that needs you to report to see your physician or your physiotherapist, it's important that you don't stick to just self-care at home. So because it's when you are properly assessed, having low back pain already, when you're properly assessed, that's when you can get specific individualized exercise programs that will be able to benefit your condition, that will be able to improve your condition and get you to be as functional and recover as early as possible. So, but there are some exercises that even when you've not had back pain, you can do them daily to strengthen your core. As I usually explain this to some of our patients in the clinic, that when you ask a 10-year-old to carry a 25-liter of water, you see the child is to lift that keg of water, the child is going to be struggling with it. But when you ask a 30-year-old man to lift that same keg, he's going to just pick it up without so much stress. Why is that? Because the stronger the muscles are, the better they are able to tolerate stress. It's not because that 25-liter keg got lighter, or there's a change in the kilogram or the weight when the 30-year-old man carried it. It is because the 30-year-old man has stronger muscles, and that's why he's able to lift it without stress. So when the trunk is strong, when your back is strong, it's able to tolerate stress better. These are Nigerian roads where when you sit in the car, there's this potholes, there's this and that. When you have well-braced trunk, what happens is that you are at less tendency of developing this menace low back pain as opposed to other persons. So there are some illustrations of some of the strengthening exercises in this slide. You will see this is called where the lady is raising up her trunk and using her hands to support. Also, the other ones, she bends the two knees. This is something you can also do even in the morning before leaving your house. You tuck in your abdomen and you tighten your buttocks and you raise it up like somebody wants to put a pillow under your buttocks. That helps us to strengthen not just what we call hip extensors, which are your buttocks muscles, but also the core, the low back. and helps with also a realignment of your pelvic, that which altogether can help you to resolve your long-term back pain. So 10 to 20 repetitions of this exercise are advisable to begin with. Also, when we have tightness, that's why exercise to the physiotherapist is medicine to the physician. And when we have before even coming down with pain, it's advisable that you look out for your holistic fitness, your physical fitness. Just like I explained that if a particular muscle is stronger, it will be able to tolerate stress better. We have exercises ranging from aerobics to strength training or resistance exercises, and also flexibility. So when we have some tight structures like the muscles beneath your thigh, that is called hamstrings, which footballers usually have their tear injury or a strain. When you have that more flexible, it also puts you at less risk of having a low back pain. So things like sitting on your bed and trying to touch your toe is helpful to stretch that particular muscle. You can also lie on your back and raise your limb up and use a claw to pull your foot towards yourself. It's also one of the exercises that you can do to stretch your hamstrings. Sitting on the wall is also another form of isometric exercise to strengthen your core. Wall sit, that's you sitting like assuming that you are sitting in the air with the wall as your support. So all these they are simple exercise programs that can make a difference on the long term. Can we move? So movement is key. Motion is lotion. And we would, even those that are not science-based on this call, will remember the characteristics of living things that has been, that we've been exposed to right from elementary school. And if you remember the characteristics of living things, put the acronym on the chat. Anyone? I want somebody to put the acronym. Characteristics of living things that we learned back in primary or secondary. Okay. Am I audible? Okay, good. I can see that. So Mr. Niger, KD, beautiful. And you will see that the very first characteristics of living thing there, which M represents, is movement. Is movement. That is, if something is not moving, then it's not living. So if a person is moving less, that means he's living less. And if it is moving more, then it's living better. So it's one of the habits we need to put in, we need to put on now and imbibe and cultivate is sitting less and moving more. Sitting less and moving more. That's the way to live better. Maintain a healthy weight. So everyone knows that unhealthy weight is detrimental to our health, not just our musculoskeletal health, like we are discussing back pain today, but even to our cardiovascular health. All right. So, and a very simple way of working on your weight is taking walks. WHO recommends 30 minutes of moderate intensity physical activity for an adult, at least 5 times in a week. This is possible. You can do 15 minutes walk in the morning, 15 minutes walk in the evening, just around your compound or from your house, maybe through to your bus stop. I decide to highlight far away from your work so that you can have this kind of recharge for both your heart health and for your wellness in general. So another thing is that you decide to use the stairs more. You can decide that, okay, I'm going to use these stairs 8 you're going to take about 10 flights for these stairs. So you use the stairs more. Maybe I'm going to go 3 times, 5 times. As you do this, your cardiovascular endurance continue to improve. So first of all, people that wants to lose weight, it's not about dropping your externals alone. You need to work on the internal. Your heart health has to be optimized, and it becomes very easy to also do more that gets the excess calories out for you to have a healthy weight. All right, so we'll move because of our time. Let's move. Also, exercise alone um, is not just the recommendation when it comes to weight management. We also need to work on your diets as you are what you eat. All right. So one other thing that leads to physical pain is when we are emotionally disturbed. So we can have psychological um, interplay where because you are stressed, your muscles are tensed, they start having spasm, and you have pain. Sometimes, even when you are dehydrated as well, you start having some form of headache because the muscles are tensed. Sometimes maybe you are about to go for an interview or an exam because of the anxiety you have. You just see that you start having some aches around you. So way forward to distress and to release some feel good hormones that we call endorphins is to practice relaxation exercise. For example, deep breathing. When we say deep breathing exercises, people don't really see the power in it. But I want us to even practice it right now on this call because not everybody understands what it means when we say relaxation exercise, deep breathing exercise. So I want us to look at me. Not even very visible. All right. So I would like you to practice an exercise where you are and you tell me if you feel different. All right. So when we want to do deep breathing exercise, you take a deep breath with your nose, and I expect your chest to rise. So this way, like you're sniffing in maybe rub or something, not hard drugs, please. Yeah. So you're trying to sniff in something. So you take a deep breath, and then for about 1, 2, 3, 4, 5 seconds, and you release through your mouth, like you're blowing hot pap, hmm? Or hot custard, or whatever you take. So you take a deep breath. I want you to practice that. So go now. Can everyone see me? Can, can everyone see me? All right, so I want you to do the same at your hand. So you take a deep breath in. I want your shoulders relaxed. I want you to sit erect, sit upright, and chest out. And then you take a deep breath in through your nose. Good. You hold for 5 seconds, and then you release through your mouth. Beautiful. So we do that 4 more times. In through your nose and out through your mouth. All right. We go again. In and out. Beautiful. So because of our time, we'll stop there. And I want you to keep up with that. And because we are aware that through relaxation exercise, we're able to distress and and improve our overall wellness. So even if you are having concerns sleeping, this also does work. Just try about 30 repetitions them and all the being your agitations, and then you are very you're positioned to fall asleep better. So let's move to the next. Okay, next slide, please. Very good. So rest is important. Rest is not a waste of time. Rest is actually a productive activity when done rightly. When you take rest at appropriate times. So rest aids healing. Just like when you have one illness or the other, the common one in space here, malaria, and then you're taking the anti-malarials, you are advised to also take adequate rest so that your body can heal. But another myth is to think that you need to rest 6 months, rest 3 months. No, because as you go into that kind of on low physical activity level or sedentary living, what happens is that other organs begin to decondition, begin to function less. All right, so let's move. Beautiful. So we've already mentioned when the things to look out for so that you visit the hospital and get proper management of your condition as early as possible before things get worse. Also, after trying all these modifications at home, you're living active, you're sitting well, you're getting to have rest, you're getting to exercise, and then you have concerns. Probably there's a trauma or there's a condition that is getting you to not be able to hold your urine or not knowing when your urine is seeping out or not knowing when you had to visit the toilet. So that's what we call loss of bladder or bowel control. These are cases where you need to visit the hospital and see your physician for proper evaluation and management. Numbness, feeling of pain persistently, even despite lifestyle changes. You sit, you have pain. You stand, you have pain. So Google is not the way forward. Google will only amplify your anxiety. So it's necessary that you seek appropriate care from the right practitioners. Yes, we are aware that those who don't know better, they find it difficult to do better and to live better or care better. So it's important that now that you are aware, you don't stay at awareness, but you allow your knowledge to translate to make a difference in your space, in your life. So let's move on to as we conclude, it's important that you take home proper ergonomic awareness. Now, rather than bending into your phone, learn to bring your phone towards your face level. Always catch yourself when you are keeping your face down, walking that will not harm your spine. Rather than sitting all day, ensure that you break your sitting cycle. You seated 30 minutes to about 45 minutes at work. Just get up, go grab a glass of water, look at a colleague, whatever, and come back to your position. Sedentary living, prolonged sitting, WHO tags it as the new smoking. So the same detrimental impact that smoking has on your health, sitting, sedentary living, physical inactivity also has as grievous impact as that on not just your musculoskeletal health, but also on your entire system generally. Stress management, the sleep as we have recommended, and seeking attention when needed would be very, very helpful to address your chronic low back pain. Okay, beautiful. So I'm closing on that note that you need to take care of your body. You need to be responsible for your body because that's the only place you have to live. And you don't have to allow your back pain to put your back on the ground. Seek proper care. Walk into that physiotherapy clinic. Walk to your physician and get proper recommendations on how to manage your chronic back pain. Thank you. It's a pleasure doing this. And I think that I would love to have questions and contributions as I can see that a number of my senior colleagues and chiefs are also on this call, I would like that we also had to the discussion and the subject of today. Thank you.
Thank you very much, physiotherapist Oladejo, for the most engaging session on managing chronic lower back pain and strategies for relief. Well, I've learned a lot, and I'm sure the members of the audience have learned so much as well. And I'm saying thank you on their behalf, as I'm even seeing their messages already. So we have a number of questions from the form that was released earlier in the last couple of weeks. I'll be reading out some of these questions, and I'm sure some people in the audience have questions as well. So please, if you have any question, kindly drop it in the chat, and then I'll be reading out to our guest speaker to answer some of them. So to dive straight into the questions that I have before now. So yes, some of the responses or some of the answers to these questions have been provided during the course of the presentation. So I would not be asking the speaker directly. However, I'll just run through and quickly summarize in my own words so as not to waste or take more of our time. So the first question I have here, how to prevent, or how can I prevent back pain because I work from home? So you would find answers to this during that. I mean, that was the first strategy he actually give about managing pain, the using ergonomic chairs or posture support foams, and then you adjust your screen to the eye to your eye level. You use foot support, and then there's 90-90 rule where your knees, your hips, and your elbows have to be at 90 degrees. So if you were lost during the course of the webinar, you can always go back and watch it on our YouTube channel. So, and then another question is on the conditions. Now, what conditions can predispose or can cause one to have low back pain? Also, this was mentioned during the course of the presentation. And they include poor sitting posture, weak core muscles, prolonged sitting or standing, heavy lifting with poor form, obesity, and lack of regular movement, and stress-induced tension. So again, you will find these answers or more explanations to this if you watch the session again on YouTube. So yes, to other questions that we may not have gotten answers to during the course of presentation, I'll be asking them now. So the first one here is, yes, the webinar is on low back pain. However, I'd like to know what therapy is effective for. So, physiotherapist, Oladejo, do you have an answer to that question, please?
Okay. I did not. I lost part of I lost you in reading that question. Please take it again.
Oh, okay. So I'll go by it again. So the person acknowledged that the webinar is on low back pain, but he wants to, or he or she wants to know what therapy is effective for chronic neck or upper back pain.
All right. Okay, that's beautiful. I would say that the appropriate, because he mentioned what therapy is effective. So there are a number of things that you can do as a form of preventive measure, which is part of what we have highlighted, that rather than bending to use your device, which puts a lot of strain on your neck because the weight of the head increases, the loading increases with every shift or displacement of the neck from the neutral position. So one of that is because if you take some medications and your pain gets relieved after some time, it's likely to come back. But if you take caution and you pay attention to the trigger of the pain, what exactly is causing it, you're able to address it from the root source. So if for you it's because you always get your neck strained, your neck muscles strained, then you need to pay attention to your posture. Another thing that could help is you need to sit you need to watch against sitting with a rounded back. You need to learn to sit up. There are postural correctors that you could use. Also, if the pain has has been persistent, you will need to visit a physiotherapist for proper evaluation to know exactly what is causing your pain. For some, is due to degenerative changes, aging, and the likes, which we call cervical spondylosis. For some, there might be other from the neck. There is going to the hands, and what we call radicular pain, radiculopathy. Is for those ones, the management line is different for those ones than someone that just has a postural strain induced neck pain. So you can reach out after this session so that we can know exactly what are leading to yours, and know the root source of your neck pain, so the solution to that. Thank you. So I don't know if that, am I audible?
Thank you very much for your response. So another question I have here is, someone is asking, if I'm feeling pain in both my leg and back, what does that mean? Well, it can mean a lot of things, but Mr. Aladejo, it's breaking from your end. I mean, the network is breaking. So you might want to turn off your video just to increase your network and bandwidth. I think it might help.
You made a remark afterwards.
Yeah, can you hear me?
I want to know that I'm audible. Am I audible?
Yes, you're audible now, but at the time your voice was breaking a lot. So I suggested you turn on your video, so at least it will help with the network strength to an extent. Hello. Oh, I think we lost him for a bit. I'm sure he will join us again soon. But while we wait for him, I mentioned something about Health Fact Video Service at the beginning of the webinar, and there is a video I'd like to play. So people in the audience would at least know more about the service and see how they can benefit from it. So I'll be sharing that video in less than a minute.
Do you want reliable and timely information about how to maintain good health at your fingertips? Do you need health tips and information that are easy to understand? Then the Health Fast video service is the best option for you. Our short video clips can help you learn all about good health and well-being in an engaging way. In just 90 seconds, you'll be empowered with knowledge on how to live a healthy life. No boring story, no medical jargon, just health facts. Our videos cover a wide range of topics, covering sexual and reproductive tips, fitness tips, and so much more. With the right information, you can make better health choices. Stop depending on unchecked information. Verify with health facts. Dial star 77728 hash from your Glow SIM to get started.
Yeah, so thank you very much for watching the video. I'm sure you at least have more information about the Health Facts video service now. And then I want to believe that stimulated your interest in seeing what you can benefit from it as well. So to do that, just simply dial star 7728 hash with your Glow SIM, and then you get started. So I think I guess the guy is back on the call now, so he will be able to answer remaining question. Oh no, he isn't. Okay. All right. So well, I saw a point made by another physiotherapist we have in the house. That's physiotherapist Tayo, and he made a very valid point. He said that age is a key factor in determining the exercise prescription, as the frequency, intensity, and as regarding the frequency, intensity, and duration. So yeah, thank you very much for that point. And then yes, just to reiterate that the WHO they also made it clear that at least 30 minutes of moderate to mild to moderate exercise for at least 5 days in the course of a week is sufficient for healthy living. So this would be in addition to other healthy practices like diets and good sleep. So physiotherapist Oladejo, yeah, thank you. I can see you in the audience now. So you'll be able to answer the remaining questions we have for you before we end the webinar this evening.
Yeah, thank you very much. I'm able to unmute now. All right. I was being asked about pain traveling to the legs, I guess, before the network itches.
Yeah, a person feeling pain in the back as well as the legs. What does that mean?
Okay, so there are a number of things that could lead to this complaint, which is what we paralyze at your back, but it's also going to your legs. And on proper examination, we are able to determine where exactly the problem is at the back. So the back, we have the cervical spine, we have the thoracic spine, as well as the lumbar and the sacrum and the corda. So we need to assess you to know exactly where the challenge is at your low back, which of the lumbar vertebrae is having an issue. For some, they might have a disc bulge. And because the discs in between those vertebral bodies are irritating on the nerves we call them paravertebral nerves. Those nerves, they transmit current in quotes or impulses to the legs, so they can mimic, they can also reproduce the symptoms that you are having at the back. So it's important that you visit when you're already having this, or is some persons call it sciatica, when you have that irritation running through to your legs, especially when there's an affectation of one of the nerves in the body, which is called sciatica nerve. Could be because one of the muscles, which we call piriformis, is tight. It may be because you even have a disc herniation or bulge. Maybe because you have a stenosis. So, but all these diagnoses are not to scare you, but it's important that for the person to not stay at home, but visit the clinic to get proper management.
Yes, thank you very much for your very very great response, Mr. Oladejo. So just because we are far into extract time, I would just want us to ask the last question. I would appreciate if you could answer the last question that we have. I'll begin from the chat. It's from Mr. A, on the issues of having various back pain conditions. So what has that got to do with back pain?
Okay, how does
diet, the implication of diet on various
okay
low back pain conditions?
yes diet has a role to play. For instance, you hear people saying that they maybe when they take sugary things they have back pain. Some of these things are myths, but taking of excessive consumption of sugary substances are also shown to produce some inflammatory responses, like increased inflammations, and this can worsen of tissue inflammation. This kind of thing. That same person that says is jedi that is having, is the excess sugar that is having, is also a culprit of prolonged sitting, which is getting to wear and tear is the structures at the back, because these are biomechanical structures that when they are not properly managed, they lead to they can give that pointer, which is pain. What I said the other time, that your low back pain is a pointer for you to seek for help and not a diagnosis. Also, when you consume a lot of sugary substances, also what happens is that you are likely to hard up, you're likely to have weight gain, especially if you are not the active type and you are just taking in without burning out. What happens is that you're going to add more weight, and then if you are overweight or obese, that's another additional strain to your back. So these are where diet can come in as it regards back pain. Also, let me add that especially for okay, no problem.
So you wanted to add something?
Okay,
please.
I wanted to say that our bone health, yes, our bone health is important. So nutrient deficiencies for especially postmenopausal women, even children, nutrient deficiencies can contribute to poor bone integrity. Lack of vitamin D, lack of magnesium, and all those things can lead to bone the integrity of the bone to be reduced. So, and all this can also lead to, when there's a little maybe trauma, a fall, those things can lead to compounded. Okay, I want to believe that this addressed the concerns that has been highlighted.
Yes, you have. Thank you so much. Thank you everyone for joining this evening's webinar, this month's edition of Health Facts Live. I'm sure you have learned maximally. I would encourage you to invite people for the next edition, which will be holding sometime in July this year. And of course, the topic and the date will be communicated eventually. So I just want to emphasize something that guest speaker said during the course of this presentation, and that is that you should not Google diagnose yourself. When you have certain symptoms, if instead of going to Google and typing that, oh, I have this, I have that, and then Google will tell you that you have cancer or you have a very bad or very serious illness, and then you start panicking, that will do you no good. Rather, you should seek professional help. So again, thank you all for attending this evening session, and thank you especially to Mr. Emmanuel Oladejo for making out the time to prepare and to deliver this wonderful webinar. I'm sure that if and when we ask you to come again, I'm sure you'll be happy to. So thank you all, and I wish you a very prosperous new month ahead. Enjoy the rest of your day. Bye.